DeLuzio, you recognize?
Thank you, Mr. Chairman. Secretary McDonough, good to see you.
Nice to see you.
I want to echo something Ranking Member Takano dug in on earlier and share his concern around the budget and the idea of cuts and what their impact would be on the VA, on my fellow veterans. I've heard talk in this committee earlier in the month about cuts to the discretionary budget. Earlier this week, an article in Roll Call dug into Republicans' Issues Conference and other coverage around cuts to discretionary spending. Those cuts, I think, would be devastating to the VA, come on the backs of my fellow veterans should they hit the VA. I read your letter, Mr. Secretary, to the Appropriations Committee Ranking Member DeLuzio, a copy of it here, outlining the effect of a multi-billion-dollar cut for the VA. It's a disturbing letter, to be frank. Amongst other things, a rollback to fiscal year 22 funding would mean 13 million fewer outpatient visits in the VA for my fellow veterans. Mr. Chairman, I ask unanimous consent to include the letter in the record.
Without objection.
Thank you, sir. So, Mr. Secretary, for my colleagues and others who have maybe not seen this, could you explain as plainly as you could, how would these proposed cuts cripple and hurt veterans' care?
Well, we've seen important historic growth in our budget over the last several years. Access to benefits has increased 71% in the last decade. Access to care is increasing. I laid out some of the numbers earlier. We would worry about going back to the FY22 number, as I wrote to the Appropriations Committee, because it would lead to as much as a reduction, as much as $26.7 billion in reduced investment to us. That would, as you've already suggested, reduce healthcare visits by 13 million, that's 9%. It would increase the time necessary to process claims at VBA, and it would lead to a $345 million reduction in our Office of Information Technology for some of the technology investments we've just talked about. So and then of course the kind of infrastructure investments the President envisions in this budget would not be possible. So we'd be back to something even less than what we've experienced in the last decade, which has allowed us to only build 4 hospitals in 10 years. And that's in a very resource-constrained healthcare economy already, including in so many of our rural settings. And so I would be very worried about our ability to meet the high standards that you all expect of the investments that you give us at FY22 levels.
I want to shift gears a bit to, and you've talked in some of the questioning, Mr. Secretary, about outcomes. We see tons of studies talking about the quality of care, the cost effectiveness of care in the VA relative to private sector care. Certainly, I'm proud to receive my health care at the VA, but we've seen ballooning costs on the fee-for-service care outside of the VA system relative to growth within VA medical facilities. Between FY22 and the revised request for 24, a 26.8% increase for VA medical services versus a 69.7% increase for care outside. Walk me through why we are seeing that growth explode on the one side. What is constraining the VA's ability to do more within VA facilities?
Yeah, thanks very much. I think there's a couple of things. The biggest challenge for us is the demands of the pandemic and the complications of care coming out of the pandemic. 1. 2, in the healthcare economy, we've seen a significant shift in where providers are working, right? So thankfully, over the course of the last quarter and a half, as I briefed in my opening remarks, we've seen a significant shift in hiring at VA, an improvement in hiring at VA. But throughout the course of the pandemic, between us and then even more so in the private sector, we've just seen shortages in key places, including in specialties. So a lot of that cost increase in the community reflects the need for us to move specialty care into the community because we don't have it at sufficient rates in VA to meet the wait times required. Third, that time frame corresponds to the enactment of the Mission Act. And I think the Mission Act does intend for it to be an easier experience for veterans to get care in the community. And that's not a value statement. I think that's just consistent with what the statute intended. And I think the statute is having its intended effect. So those are 3 of the trend lines that we're seeing. My goal is to make sure that we are adequately staffed such that we can, apples to apples, compete for veterans to come keep their care in the VA. When we're adequately staffed and when we keep vets in our care, we offer the best health care in the world. And I want to make sure that we're actively fighting for that vet's care at every turn. The thing I can do to ensure that we do that is to make sure that we have all the people we need. The thing I'm asking you all to do is to invest, to make the investments the president's asked for here, to ensure that we have the institutions, the buildings, the technology, and the people to be able to do it.
Thank you, Mr. Secretary. Mr. Chairman, my time has passed. Thanks for indulging me.
Representative Rosendale, you're recognized for 5 minutes.
Thank you very much, sir.